Welcome to Neuro Stories, the podcast that highlights the people behind neuroscience at the Walton Centre. Together, we'll lift the lid on the complex worlds of neurology, neurosurgery, and everything in between, hearing fascinating tales of the incredible staff and services carried out in the hospital every day. Hi, Katy.
That's good timing.
Oh, it was good timing. Normally I have to search for you. Okay.
Hi, I'm Katy. I'm one of the advanced critical care practitioners working here at the Walton Centre.
People refer to you in the hospital as ACCPs,
That's
that's Advanced Critical Care Practitioner. Tell me about what that means.
So we're a team of both nurses and physiotherapists who have developed this additional skill set, worked in the Walton Centre, most of us for a number of years. So we're very experienced in what we do, working with our neurocritical care patient population alongside our medical colleagues, and we provide daily care for our patients on the intensive care unit. But it's just a different skill set. So be that from a nursing or a physiotherapy background, we can bring those additional skills into play really for the care of the patients.
That's really fascinating then, isn't it? Because you mentioned there that it's nurses and physios, and that's maybe one of the ways to get into this advanced profession. What's your background then? How did you start in healthcare and in the NHS?
So my background, I'm a physiotherapist by background. So I worked rotations at the District General Hospital, not too far from here, and then came to the Walton Centre as a Band 6 physiotherapist.
So that's a senior physiotherapist, isn't it? Yeah.
It is, yeah, specialising in respiratory. And I worked my way up then to become a respiratory lead for the Trust. I was very happy, enjoyed that role, enjoyed the care that I gave the patients, enjoyed the team that I worked alongside within therapies, but an opportunity came up for me to join the Advanced Critical Care Practitioners team. It was definitely stepping out of my kind of comfort zone, and it was going to be a challenge. And there aren't an awful number of physiotherapists in the role across the country. It's a more of an unusual step, and certainly an easier step for a nurse. But thought it's a challenge. I'll be the first physio in the team within the Walton Centre, and thought I'll give it a go and see how it goes. And here I am. So yeah, still in the post. Been doing the job for 5 years now and enjoy it. So yeah, I feel like we can bring something different to the team. So there's 2 physiotherapists now on the team, and we can definitely bring a different skill set, which complements really nicely against with the nurses that we have as well.
Of course, and people I think forget how far-reaching physiotherapy can be. I think they think that you are given a set of exercises by a physiotherapist and off you go to recover maybe an ache or a pain that you've got. But so frequently I think people don't realise how early in somebody's care physiotherapy starts, like with respiratory, for instance, like you were mentioning there.
Yes, that's right. Yes. So we get involved very early with the patients on the intensive care unit. A lot of our patients may be ventilated, and as you said, the respiratory care is the really key important thing at that point. So the patients are naturally going to have, complications such as infection, chest infection, but also in early rehabilitation, which is really key. So obviously a patient that's sedated or that's, spending long periods of time in bed, muscle wastage, fatigue, things like this really become a problem. So that early rehabilitation of getting the patients up, getting the patient sat on the edge of the bed, out in a chair, not only does that, improve muscle strength, but also from a psychological point of view, it's really, really important that the patient can see that they're moving forwards. They're not just left lying in a bed all day long. And it's, it's a different interaction. It's something that's pushing them forward, that they can really see a difference. And for relatives as well, to be able to see a patient who's, moving forwards and progressing is really important. So we have a really key role as physiotherapists on the intensive care unit, which, as you said, isn't always recognised. It's not that physiotherapist running onto the football pitch with a sponge. So.
Exactly, the magic sponge therapist. That's what people think.
Yeah.
So why challenge yourself to go that one step further and go for that advanced practitioner role?
Good question. I think, as I said, I could have stayed in my comfort zone and, I enjoyed the job. And I suppose sometimes you look back and question, why did you do it? But, I was still fairly early on within my career. There wasn't an awful lot of progression from the role that I was doing at that point. So I thought, how can I improve me? How can I bring something to that team that didn't already exist? So as I said, there wasn't a physiotherapist in that role at that point. So I could see the opportunity. I'd already worked at the Walton Centre for a number of years. I've been here 12, 13 years now. I knew the consultant body, I knew the team, I knew that I'd be well supported. And I was very open and honest and said, let's go for this. Let's see what I can bring to the team. It may or may not work. I could step back if needed, but yeah, I think it's been a success. So it's just about pushing yourself, isn't it?
Yeah, it's bold, isn't it?
It is, yeah.
There's a courage around that.
And as I said, I've worked my way up from being a junior physiotherapist up to a senior level, and that in itself is a challenge, but then to take on as well. So we do a 3-year master's qualification.
Yeah.
We do 2 years under the Faculty of Intensive Care Medicine as well. So we've got clinical competencies to meet, and lots of those were very, very different. So for a nurse who's stepping into that role, they've got skills such as cannulation, such as just handling of drug administration, things like that. Whereas as a physiotherapist, that was something that I didn't have at all. We weren't involved in that element of it, but very much in terms of the ventilator weaning, in terms of the chest clearance. So there was different elements that I could bring to that role, but very much a challenge, and very much something that I knew wouldn't be an easy path, but I knew that I'd learn a lot and develop as a person and professionally, and I've really enjoyed that journey.
Why go into a caring profession like you have?
So I suppose my parents are both within the healthcare profession, so I think that's probably had a big impact. My dad is a paramedic, my mum a pharmacist, so
useful as well when you're doing your tests and things.
Yes, that's right. Yeah, all the pharmacology and the prescribing, and yes, very much so. I think I just spent time with a physiotherapist when I was kind of deciding what to do, and from GCSEs and A levels, and didn't really know an awful lot about physio within intensive care at that point, but very much like the physio as a profession. And as you said, there's so many opportunities to go off and do different things, to work within different areas. And I think that for me was a real advantage to think, well, actually, I can get this degree, and actually there's scope then to progress and to do different things. I don't necessarily feel like, even though it's a very much a vocational profession, you're not necessarily having to fix into one particular area.
Yeah.
So, and then having done those junior rotations, I was very much inspired by a physiotherapist I worked with at the Royal, who I'm still very good friends with, and just her passion and her enthusiasm for respiratory and for intensive care and for making a difference when those patients are at their sickest was inspiring, and that's what led me into the career that I do now.
That's amazing, Katy. That's so interesting to hear that inspiration and the family background and all of that. What does a day at the Walton Centre look like for you?
So a day could be a day or a night shift. So we do, long shifts. But a typical day shift, so a long day for us, would start at 8 o'clock. So we get a handover from our night shift colleagues. So there will always be an ACCP and a registrar who medically manage the unit overnight. So there's a handover then from the night shift to the day shift, and the day shift would ordinarily involve one of ourselves, one of our ACCPs, a registrar, or 2 registrars and 2 consultants who manage the unit. So once we've had that handover, we'll go round and we do our ward round, in which the unit's pretty much split in half between the two consultants. So we review every patient, and each patient has an assessment, an examination, and a plan made really for the day as to what we're looking to achieve for the day. Are there any referrals that need to be made, any further investigations, scans, blood tests, anything like that? So each patient will be then reviewed, and from the end of that ward round, then we can look at what then needs to be done from there. So there might be a number of scans that need facilitating, so in which case it might be myself who takes a patient off to scan. They may need line placement, so to be able to give medications, so we would place some of the more invasive lines, the central lines. It might be that we're involved in the drug administration, that we're reviewing some of the medications that they might need based on either neurosurgical or neurology opinions, so things like that can be looked into. And it's just day-to-day care of these patients really, and progressing them. So be that if we can wean their ventilator settings, make progress, ensure that they're spontaneously breathing for themselves for a little bit longer, or weaning off that ventilator. In terms of sedation, it might be weaning off their sedation to a point where we can bring them off a ventilator and we can extubate them. So it's just really moving them through that journey, which for some might be quite quickly. Some patients will only stay with us overnight, just as a post-op kind of case.
Right.
Whereas we do have some patients who will stay with us over 12 months, so it can be a much longer, slower process. The day-to-day can change very rapidly, as you can imagine. This, our patient cohort, things can change quite quickly. Patients can deteriorate, patients can improve. It goes either way. So it's just that constant kind of awareness of where the patients are at. There's a bedside nurse for each patient. So it's just then checking in to see, are there any needs? Has anything changed?
Yeah.
Has a patient deteriorated? Might now want to scan, whereas previously they were quite stable. So it's an ever-changing environment.
It's that real-time problem solving.
It is.
For each and every patient.
Yes, that's right.
Wow.
Yes, yeah. And we're also, sometimes called up to the wards as well to help to assist our smart colleagues who provide an outreach service onto the ward. So if they've got a deteriorating patient, we might need to review them, or occasionally we'll do line placement for some of the ward patients who are requiring further treatment which require invasive lines. So it's just that, constant kind of awareness of what's going on in the unit and what's needed and where we can fit in and how we can assist. And we do training, so we have rotational registrars who are with us for usually 3 months, who are very, very experienced in the intensive care environment, but not necessarily in the specificity of neuro intensive care, including brain and spinal injuries. So we're there to kind of teach them to explain kind of the Walton way and the way we do things. So there's that side of it as well. And, teaching the nursing staff, and we're always trying to upskill with certain things. We're looking at, lung ultrasound. We do intrathecal antibiotic administration and other key skills that we've really kind of made our niche here at the Walton Centre, which is good.
Crikey, you haven't got a chance to sit down.
No.
What is ICU like?
I mean, it's a fantastic place to work. We're a very close-knit team. The experience that we have and the journeys that we go through with our patients, with our relatives, it really brings you together. And I think, as you can imagine, we have good days, we have bad days, but we very much lean on each other and support each other through that. And I wouldn't have stayed, I wouldn't be here 12 years working, with the same team if I didn't, really value that and really value the input of colleagues. And, they really have helped me to progress, and it's nice that I can help others to progress now within that environment. And it's nice to see how everybody pulls together for the benefit of our patients and relatives. And it's sometimes just the little things. It's taking 5 minutes out to speak to somebody, or to, recently been involved with trying to modernise and improve our intensive care garden. And it's just sometimes being able to take patients out there for 5 minutes. And actually the team pulls together to be able to do that for what might only seem, a short period of time, but for a patient to be able to get out to see the blue sky, to see, some of the hanging baskets we've been able to put up. People will go above and beyond to do so much for our patients, which is just really special. Yeah,
and I can see that means quite a lot to you in your role, like having that environment to work in.
For us, it's an everyday environment, but to anybody coming in, it's a very scary place. There's so many machines, so many noises, so many beeps, and these patients are critically unwell when they come to us. It's just trying to make people feel as safe as possible, to feel as, to answer questions, to, understand their concerns, to hopefully allay those concerns a little bit where we can. Everybody as part of that team tries to do that and is very much involved in doing that and trying to improve that environment and improve that experience as much as we can. It's not always going to be easy. It's not always going to be a smooth path for our patients, but if we can just take the time to make that as kind of smooth a pathway as possible, we will do that. And everybody on the team does that and can understand, what we're trying to achieve there as a team. What's the most rewarding part of what you do? It's just being a part of the team and just feeling like you can really make a difference. As I said, our patients are critically unwell and very, very sick, and it is just thinking that actually you can make a difference. I would love that it was a positive outcome for every single patient. That's not always the case due to the nature and the environment that we work in. But even if that's not the case, just the fact that you've made a difference or you've been able to have an impact, if you've been able to speak to somebody, speak to a patient, speak to a relative, and just in some way improve their journey through the Walton Centre, I think that's what really makes it special for me, that I can play such a part in that. Are there any patients that stick with you? There's been patients over the years who I've been able to, take out into the garden and they've perhaps been with us for 3-4 months. They've been in the same room, same 4 walls. And you can see psychologically how really difficult that is and hard for patients, that they're in that environment. They've got no interaction with anything in the outside world. It can feel very closed in, very claustrophobic. And just to see a smile on their face, to see actually, here's some blue sky, here's a different, environment, here's some fresh air. Feel the sun and the breeze. Yes, yeah. Or to perhaps, give a patient a voice for a period of time. So some of our patients will be intubated and then have tracheostomy. So they lose the ability to speak, and some may be able to write things, others may not. And just to then, for the first time, to be able to allow a patient to speak by using what we call passing your valve is incredible for them to. I remember in one particular, we had a young patient who we surprised his parents. So they didn't know that he'd got this passing your valve on. We put it on, we trialled it, and then we asked them to come in, and he said, hello, and they literally just broke down, which we all did in the room. It was lovely to see, but just that experiences like that are so special that you can really, really make a difference when, as I said, these patients are at their sickest. Okay, Katie, are you braced? This is the quickfire round. Let's go. What would you be if you weren't an ACCP? Vet. I was always into, care of animals, and I'd meet a dog in the street, a cat in the street, it didn't matter. I was always there and loving animals. So yeah, I was always keen to be a vet.
What's your biggest hobby?
Netball. So yeah, I really enjoy netball. So that's my kind of, outside of work, that's what I enjoy playing, team sport. I have a fantastic group of friends that I play alongside here in Liverpool. So yeah, netball for me.
What's your favourite song?
Anything by Matchbox 20. Old school. So yeah, I have a friend who lives out in the States, and we used to listen to that on all the time in the sun.
Favourite book?
Where the Crawdads Sing.
That's a classic. Great book.
Yeah.
Favourite animal?
Dog.
So the therapy dog that comes into the hospital every now and again, called Lemmy. Are you a fan? Have you met him?
I have, yes. We don't have Lemmy. We have Poppy.
Poppy, yes. She's a little spaniel, isn't she? Yeah.
Poppy been exception. Poppy is a lovely little dog.
Adorable.
Yeah.
Food you love?
Anything and everything.
A woman after my own heart. Any food you hate?
No.
No? Eat anything? Great. You're the first person not to have a food you hate. That's great. What advice would you give to your younger self?
Trust your instincts. Take the opportunities.
Finally, something very few people know about you.
I was an England netball mascot live on Sky Sports around Liverpool Echo Arena.
And when you say mascot, does that mean you were in like an outfit?
That's correct. You would never have known it was me.
What was the outfit?
I had like a 10-foot head on.
We're just going to walk through now. And I always end up getting really quiet when we're going through this bit, because I always keep my elbows in as well, because I'm worried about getting in trouble.
Anything or anybody.
We're just coming out to the little garden area. Tell me about this wonderful space, because immediately you feel that calming sort of influence of being outside.
That's right, and just for our intensive care patients, just have some daylight, some natural light. We can feel the fresh air. There's a little bit of a breeze through here. We've got a wind chime. We've got some lovely, as you can see, hanging baskets that have been recently planted up and some raised beds. It's just a little bit of colour, a little bit of natural light, natural environment. It's just a lovely space. Intensive care, delirium is a huge problem that we usually have to medicate for, but something like this, bringing a patient out into a natural environment, which is really, really important. We're very lucky to have our outside room here, which, as you can see, has got a skylight up to it, so patients can spend a prolonged period of time in here. So we can put a patient on a ventilator in here with a family. They've got some private space. It's a private environment, but just to be able to look up, to see the blue sky, to see the clouds, just to see the everyday, things that we take for granted, is huge.
Let's just have a look at this room, because it is really, it's almost like a side room, but outside.
Yes, that's right, yeah. So clinical to some element, we can't unfortunately get rid of that, but just to have, windows on two sides, to have a skylight, to be able to look up to see the sky. But as I said, all of it, the clinical necessities are here. So we've got piped oxygen and air, and we've got monitoring, and we can put a ventilator in here and can monitor a patient as closely as we will be able to within the intensive care environment. But it's an outside room isn't it? It's it's being able to,
and it's really pleasant. Like you said, the light's lovely. How many ICUs would you say around the country have access to an outside space?
I think very few now. So some intensive care units will be able to have access to an outside space, perhaps a balcony, or perhaps be able to ultimately just taking patients or relatives out of the back of an intensive care unit. We used to do it before, where we take them just into a small outside space that really wasn't designed for that, but just to be able to give them that experience of outside. Whereas for us to have this specialist built room, we're incredibly lucky and incredibly fortunate, and within a very small minority of intensive care units.
And it touches on the importance of having a charity support the hospital, like the Walton Centre charity does here, because they helped with the funding of this.
It's massively important. There are so many additional benefits that the charity really brings to us, and we're very fortunate that we can ask for things and they're able to support us, and this money really does make a difference to patients' relatives, and you see that day to day, and we utilise it an awful lot, and so we do get value from this, and very fortunate for the charity to be able to have that.
How has ICU changed? How has your profession changed?
So from a physiotherapist, I suppose, even the fact that we can now work within these advanced practice roles that are really slightly out of scope of practice, that's been a huge development in the last few years, which is really positive to see. It would very much have been advanced nurse practitioners. And as I said, now it's nice that actually, paramedic prescribers are coming in, and paramedics can certainly come into the ACCP role, and physiotherapists as well. So this is really positive for our profession, for me, as a physiotherapist. In terms of ICU and how that's changed, I think it's always pushing forward. There's always new, developments, new ideas, I suppose. There's an awful lot of research that goes on now, and to push forward what we do and how we treat patients, and clinically the decisions that we make. So I think decisions are a lot more well informed as to what we do, and reliant on a lot of research that has been done, which is really, really positive. And but there's still so much more of that out there to be done. No patient follows a very set pathway. It's always a very unique experience for each, and it's managing individual problems as and when they arise. So none of the job that we do is ever very protocol driven. It's that you've got to really think outside of that box. So more evidence and more research is out there, it does become that this is the treatment of choice, and this is the best way to manage this particular pathology or process. And I think that will continue, which is really positive. I think there's been developments in terms of, I suppose, as a physiotherapist, in terms of early rehabilitation. I think there was always anxieties around that, these patients are sick, is that the right thing to do, to be getting them up early? And there's different opinions on that, and there still is, and there probably always will be. But certainly within the Walton Centre, we find that rehabilitation of these patients early is key, and does prevent that long-term intensive care acquired weakness.
And like you said, the research that is behind this kind of these methods is wide-spanning, isn't it? It's confirmatory.
It is, that's right, yes. And we're very privileged, and we do an awful lot of research here at the Walton Centre. We're involved as an ACCP trial in a number of the studies that perform. So we will allocate patients to clinical trials as well, which is really key, that we can gather this data and gather this evidence, which will then inform us, for future management.
Has tech and innovation had an influence on different ways to do things? Have they had an influence?
I think they are beginning to have an influence. I think there's an awful lot of tech out there that actually we could possibly utilise more in an intensive care environment. At the Walton Centre, we've got the complexity of neuro patients who often have brain injury, which can add to the complexity of managing that. So certainly there is, a lot of things out there which may be better for a general ITU population, whereas for our patients to get the understanding, to be able to follow through some of these things, to be able to engage in such activities might be more difficult. But we do certainly, and we have used in the previous things like eye gaze as a communication method. We do use iPads occasionally for interactions and things like that. Some of the other things that may be utilised more elsewhere, things like a Wii or games that can be actually interacted, very much depends on a patient who's able to follow a command, to be able to process that and then act on it, which is more difficult for our neurosurgical, neurological patient population.
So just specialist environment, isn't it? What works for a general population of ITU patients isn't necessarily going to work here, is it?
No, that's correct. Yeah, it's a different complexity. It's a different added kind of challenge for us.
And everyone having a different path as well. Like you said, there's no right, you've had a brain injury, this is the pathway, because obviously that person is an individual and you treat them like that.
That's right.
Where's it headed, do you think?
So I think the ACCP profession is heading kind of, as I think just further progressing our role. Certainly within the Walton Centre, I think there's additional skills that we can gain. So we're very fortunate here in that our skill sets are being continued to be added to, and we're trained in additional things that for the benefit of our patient populations, that we can provide these timely interventions. And I think that will continue to grow. Echo is a big thing. That's our next kind of target for us as a team. So that's looking at ultrasound of the heart to be able to determine specific treatments. So at the minute we're able to utilise lung ultrasound. So we use that to influence our decision making in terms of antibiotics, in terms of ventilation weaning, but also to be able to image the heart in real time at a patient's bed space is another skill that will actually make a big impact upon our treatment for patients. So that's something that we as a team are looking to push forward to develop and to be competent in, to utilise. And there's numerous other skills similarly that we can push forward and kind of bring into the Walton Centre as this specialist team of advanced practitioners.
So it sounds like it's all about diversifying that skill set that you as ACCPs have, getting that throughput of more people into that profession to widen it out even further.
I think just widening the skill set as a team, we're a complete team now, so there's 7 of us, so we provide 24/7 cover for the intensive care units. There's always an ACCP who's on shift at all times. So I think as a team, that's probably us that's reached capacity, but actually, you know, we're a very motivated, enthusiastic team. We're very keen to progress and actually look at additional possibilities, additional skills that we can bring into the intensive care unit to improve our practice and our decision making. So I think it will just continue to grow, hopefully, and additional skills that we'll be able to develop and can utilise. It's fantastic, you know, professionally to be able to do that and have, as I said, those opportunities. These were things as a physiotherapist I could never have imagined, you know, being able to be competent and to be skilled in and to be able to bring to that patient. And as, you know, a single clinician being able to have so many tools in the toolbox, as it were, is just fantastic. And it's only going to improve each individual's care, which is really, really important.
And you've given so many good points over the course of this conversation.
It's just important to recognise that ACCP is this new and fairly up-and-coming role. I think it's a lot more established now in a lot of intensive care units across the country. But it's this skill set and additional skill set that we can bring to what is already a fantastic team of professionals across the intensive care unit. I would definitely encourage other people to consider such a role if they're interested in going to that, especially from a physiotherapy background. As I said, it's not as common a pathway, and it might definitely seem a daunting pathway, but it's achievable. I hopefully have been able to prove that, and there's an awful lot to learn. But as a clinician, then you are able to offer your patients so much more. So I think it's just the possibilities are out there, and you know, where's the sky's the limit, isn't it, as to where we can get to. So keep going, keep seeking out new opportunities.
Thanks for listening to Neuro Stories. You can listen to more episodes on Spotify and Apple Podcasts, and you can stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.